Dr. Shay-Lee Bolton joins us now, researcher, epidemiologist, assistant psychiatry professor at the University of Manitoba. Dr. Bolton, good morning.
Morning.
Thank you for doing this. I really appreciate you finding some time for us here. But as you know, it's a really important day. We talk about HSC. We talk about the great doctors and the staff, the frontline workers. But it's important for people to realize that research, like world-class, important research, happens at HSC. And you're in charge of a study. It's your study, an evaluation of mental health treatment during a pandemic. Tell us about it.
Sure, happy to. The funding that we received from HSC Foundation has been really important for our team. What it's allowed us to do is to provide rapid access to mental health treatment for Manitobans during the pandemic and to evaluate whether it's actually helping them. So one thing we know is that about a quarter of the population here in Manitoba are struggling with their mental health, and that's mainly feelings of depression and anxiety. And since COVID, of course, began, there's been a lot more people experiencing difficulties. So one of the most well-researched gold standard treatments is called cognitive behavior therapy, and many people know this as otherwise known as CBT. So CBT is a really effective way to deal with depression and anxiety. And what you do in CBT is you break a situation down into the thoughts and behaviors that happen, and then you look at how those contribute to feelings. So, for example, let's say that something goes really wrong for a person at work. They might have a negative thought, something like, I'm a total failure because of what happened. And that leads to behavior. So maybe now they're avoiding going into work. And what that does is it leads often to feelings of depression. So what CBT does is it challenges that initial thought of being a failure and teaches skills of how you can look at the situation differently. And so typically CBT is about 12 to 16 sessions one-on-one with a therapist. But as I'm sure many of the people listening realize, the demand for this type of treatment is really, really large. And we simply just don't have enough psychiatrists and psychologists in the province to provide this to everyone who needs it. So because of this, our team, what we did was we developed a class-based model. So this is where we can have large groups of people learning those critical CBT skills from a single clinician facilitator, and that helps people get more rapid access to the treatment that they want and that they need. And what we've called our program is CBTM, and so the M stands for mindfulness, which has also been incorporated into the classes and has good evidence for helping mental health. Mm-hmm. So our team had collected some preliminary evidence that the classes were helping people and were able to reduce symptoms of anxiety and depression, and things were looking really good. But then there was a problem that COVID happened, and we were no longer able to run these large groups that we had of people coming together in a classroom format. And so what we did was we shifted those classes to be held virtually. And so we actually developed two options for the classes. The first was having the classes run in Zoom. So that's video conferencing, similar to that classroom style with a single facilitator teaching the class. And then the other one we developed as an online course. So people can actually run through that same material, but now they do it at their own pace at a time that's convenient for them. And so although both the options sounded really promising and made a lot of sense to our team, we actually needed to evaluate whether the people in the program were still seeing the same benefits, even though it was held virtually. And so that's where HSC Foundation came in. So we really needed to evaluate the effectiveness of these classes in improving the mental health of Manitobans. And so, of course, programs are only as useful if there's actually change for the patients. So what we've been doing now is we've been recruiting people into those classes and into the online course, and we're measuring their mental health symptoms over a 6-month period to see what happens for them. And in fact, actually, anybody that's listening today to the program, we're accepting referrals from any of the physicians in the province, or people can actually self-refer through our website, which is cbtm.ca. So that's kind of the gist of the work that we've been funded to do.
I have to have you back to talk more when I have more time. We're obviously focusing on the Radiothon today, but I would love to have a longer conversation with you about this research. And what I find incredible about this is you're doing it here, and it's going to help people here. But this research that you're doing is going to help people everywhere, right? I mean, which is so cool that we're seeing research done by you and your team here that will benefit so many people everywhere.
Absolutely, yeah. It's really quite important work.
Mm-hmm. Make your 30-second pitch for people listening that haven't given yet. Many have, because we're raising a lot of money already halfway through the Radiothon here. But make your pitch. Well, why is it important for people to give whatever they can afford today for HSC, the people that work there, and the research like yours that's being done there?
For sure. So, I really think the research dollars are what makes the dreams become reality. There's so many brilliant and skilled researchers here in Manitoba. I think it's actually really quite unbelievable the talent we have in this little have-not province of ours. They have great ideas, really novel ideas, but without grant funding, these excellent people can't really get creative and find solutions to healthcare issues. I think the great thing about HSC Foundation is that the money is invested in those amazing researchers and scientists in our province to improve care for Manitobans, but as you said, it applies across Canada.
Dr. Shay-Lee Bolton, thank you very much for this.
Thanks so much for having me.